Hello all. Today's our guest is Dr. Jose Issac, former head and professor, Government Homeo Medical College Trivandrum, member faculty of Homeopathy, Kerala University, visiting professor at various foreign universities, former CCH member, patron of IFPH, and most sought after teacher of our time, and advocate of Hahnemann in homeopathy. Let's welcome Dr. Jose Issac, and I welcome you all for the session.
Okay, thank you, Dr. Bindiraj. Can you hear me?
Yes, sir. Yes, sir.
So our topic is allergy and how to manage it. See, allergy is a modern term, but before this, Hahnemann in his organon clearly explained what is allergy. In his aphorism number 117, and what he said is idiosyncrasy. Idiosyncrasy is a problem even now, and also even during the time of Hahnemann. An allergy is a reaction by the body's immune system to a normally harmless substance, which is called the allergen. So the problem is, it can be anything. Any normal substance can become an allergen for a particular individual. And the immune system overreacts to something that is usually not harmful. This is the problem. And nowadays, throughout the world, this allergy is a big problem. And the number of allergens are increasing day by day. Hahnemann has said that this is a peculiar corporeal constitution, a particular constitution, which have an oversensitivity or susceptibility to certain harmless things which occur in nature. So this oversensitivity of the individual is the core or the basic reason for the allergies. And the symptoms depends on how strong is the allergen, and second, or how much we are exposed to this allergen, and mainly our own immune system or susceptibility. So once the susceptibility is low or high, any allergy can come in. So basically the problem is, in modern times, people look for the allergen or try to locate the allergen, remove it from the food or whatever it is. And there are some blood tests also. But none of this can give a permanent cure for allergy. We know nowadays, even in America, when a child is born, before leaving the hospital, they give a big list of things that the child should not take in his lifetime. And many people cannot take their breast milk, and many children are given soya milk and many other substitutes. So here, all this develops because of the deficiency in the immunity. And only if that immunity is corrected or brought to the normal level, this problem can be solved. So here, the thing is, the approach towards allergy is entirely different. Because many people used to come and ask us, what is your treatment for allergy? Why you are not looking or trying to locate the allergen? Did you find out my allergen? And they feel that they think that, or they are taught that only if you find out the allergen, you can treat it. See, Hahnemann has said in the aphorism 117 that allergen is only one part of it. But the basic or the root cause of allergy is our own immune system, weaknesses in or susceptibility or weakness in our constitution. Some people have, as you know, have cannot tolerate cold or cannot tolerate wind. Many such things are there. So likewise, everybody, all these allergic patients have certain susceptibility and they are weak or their constitution is weak. So basically, the treatment of allergies is to remove this deficiency or weakness in the constitution and allow us our vital force to work freely. This is what we are doing with the homeopathic treatment. Now, 30 to 40% of the population worldwide has allergy. And homeopathy is the answer for this. Out of this, 29% women have seasonal allergies. And 21% men have seasonal allergies. And in children, it is more, and it is 27%. So this percentage is growing every day, day by day. And there is no answer for that. So basically, there are two things we have to consider. The inherent power of the influencing substance or the allergen. And second, the capability of the vital force or the constitutional weakness. So whatever may be the allergen, homeopath need not have to look for the allergen. Of course, we have some remedies like for allergy from prawns. Many times lycopodium works very well. Like that, we have some medicines. But still, this is a constitutional weakness, and the basic idea of treatment, the homeopathy, is to make the constitution stronger. Thereby, the immunity will be better in these patients, and the next time they are exposed to these things, they should not get, or their immune system should not start attacking it. So in an allergic reaction, what is happening is, once they are exposed to that, antibodies are formed, and then these antibodies, whenever they get exposed to this allergen, start reacting and produce symptoms. So the basic treatment in the beginning usually is a symptomatic one or an etiological one. Etiological one, we may not be able to get it very clearly. So mostly we are treating the symptom we start with the symptom. And when we look into a case of allergic rhinitis or allergy urticaria or a gastritis, what we have to look for is the symptom. What aggravates or what ameliorates this condition or what causes this condition. But when we treat, when this allergy go on continuously for some time, many people go into asthma. And in an asthmatic condition, what we are looking for is the postural modalities, weather modalities or thermal reactions. All these will help us to start the treatment with. And finally, we go to, after relieving the symptomatology to a great extent, we will go to the constitution, the miasm, then the constitution. And mostly allergies are due to psoriatic conditions and psychotic ones. So this is the basic idea about allergen, which Hahnemann has given us very clearly. And usually these allergens enter the body by inhalations, injections, or skin contact or by skin contact. Then usually these allergens produce symptoms on the respiratory system, gastric system, skin, These are the main areas. And nowadays, the tests are either the blood test or the skin test or food challenge tests, which they usually do. But for us, locating the allergen is not a very important thing in our practice. In our practice, we are trying to find out or to clear the weaknesses in the constitution. Once the constitution becomes stronger, no allergen can affect the body. This is the basic principle of homeopathy, like any other diseases. Then, what we have to do in each case, as I told you, usually it affects the respiratory system, the gastric system, then the skin. Nowadays, we find a lot of allergies like urticaria and many other conditions. And many people don't know how it is produced or what is the real cause of it. And sometimes it's very difficult also because even pollens, in European countries, they say pollinosis, which comes in every change of weather, either cold or heat or something, or when the flowers start coming out. The pollens, that is one of the main, that's what they say. The symptomatically what they say is when the blooming season starts, my respiratory complaints also start. So these are all clues. Some people very clearly will come and say that they have a particular allergy to a food substance, a particular, nowadays we see a lot of gluten allergy. Then we see dairy or milk allergies, which we see in the Western countries. So gluten allergy, one remedy which is seen in the Murphy's repertory for gluten allergy is natrum muriatica. So, but basically, if you want to cure this case, you have to remove the constitutional weakness. Once the constitutional weakness is cleared, only we can say that the treatment is effective or a permanent cure. As I told you earlier, the two most important homoeisms which we see in practice in every case of allergy is sora and psychosis. Here also, chili patients who are psychotic, Thuja is the main remedy, ultimately. Then, the conditions which comes from exposure to allergens. In the respiratory area, we find a lot of allergic rhinitis nowadays, with the sneezing, coughing, nose block, like that. There's so many symptoms, and running nose, recurrent fevers. Then the bronchitis, that is cough. Then asthma. Then sneezing, like that. In gastritis, what we see is pain in the stomach or diarrhea or some problem with the gastrointestinal system. And the skin, the most important one is urticaria. All these conditions can be cleared by homeopathy if it is done in a proper way and continuously, and an average of usually people are coming later in their life or having this allergic problem for 5 or 6 years. After that, they come to us for treatment. And so it takes corresponding time to cure. As Haniman has said, it needs several anti-miasmatic medicines in succession to cure a chronic disease. And once the myosomes are removed, we have to strengthen this constitution. Then go to the constitutional remedy. So first the etiological or symptomatic remedy, then to the myosome, then to the constitution. So if you follow this way, in my practice, I have seen thousands and thousands of allergic conditions. So I'm sure that everybody is waiting to know about the medicines and everything. So in every webinars, doctors are more interested in this. But as a preliminary introduction, I was telling this. Coming to the allergic rhinitis, a lot depends on the case taking of the doctor in identifying the problem. One should know that this is a respiratory complaint, and in respiratory complaints, mainly the climate, the temperature, these are playing a great role. So what we have to look for is the climate, which climate it gets aggravated or ameliorated. And when this recurrence is a psoric trait. So some people or some parents bring their children saying that the child is getting recurrent cold, recurrent sneezing, recurrent this way, that way. So this recurrence of complaints is a psoric trait. That's why I said basically allergens or allergy complaints are basically psoric, then psychotic or syphilitic or tubercular myasthenia. So here the main points to be interrogated in a patient is the thermal modalities, weather modalities, then the posture. Posture is very important in homeopathy. Then the time modality. You know that the time modality decides many times or help us to arrive at the correct remedy. For example, a 3 a.m. aggravation, which is very commonly seen. We have lots and lots of remedies on 3 a.m. like antitouch, Apis mellifica, Blata, Grindelia, many remedies. I don't know why we have so many remedies for 3 a.m. to 4 a.m. aggravations. And most of these patients have, in the beginning, they have an attack once in a while, then it becomes more frequent, and then it becomes almost every day. This is the usual pattern. So the treatment may take more time in people who have this for a long time. Another important thing which we see is at first, usually the patient says that in the beginning I had an allergy for only 1 or 2 things, but now the number of allergens are increasing. Here what Hahnemann said is, when we go through the chronic diseases, Hahnemann says, the chronic myosomes are growing day by day, and so the number of allergens of an individual also increases day by day. Even though even the most robust and healthy constitution may not be able to get rid of this until it is homeopathically treated. And in the homeopathic treatment also, we have to look for the symptomatic treatment, etiological treatment, then the miasmatic, and finally to the constitutional level. And this constitutional level treatment is the one which makes the immune system better or make this person healthier, and which prevents this problem from coming back. Because there are lots of patients who are coming and saying that 1 or 2 years it was not there, but it came back again. The problem is with the doctor as well as the patient. Many patients, once the symptoms are over, they stop the treatment and they go away. And then when they get it again next time, they will come back. So in the beginning itself, as a doctor, it's our duty to say that You have to continue the treatment for such and such time. And once the symptoms are over, also just continue for a few months. So I used to tell my patients like this: after the symptomatic treatment is over, I can give you something which can prevent it from coming back if you continue the treatment. And one of the main symptom in allergy is sneezing. And for this sneezing, our remedies are usually the sneezing. Many people used to complain that it's in the morning, running nose, sneezing, coryza, like that. Or in some cases, there's a little bit of fever in the morning. Here, there are many remedies like Silesia, Thuja, sulfur, Naxomica, arsenic album, arsenic iodide. And out of this, the main hot remedies are arsenic iodide, sulfur, even and most of the morning aggravation remedies for sneezing are chili remedies like Silesia, Thuja, arsenic album. And there are some remedies which needs a complementary remedy for curing the case. For example, arsenic album. Kent in his Materia Medica lectures on Materia Medica says, arsenic album will not cure an asthma unless it is followed by Thuja. It is written in the chapter Thuja in his lectures. And we all know that one of the main remedies which we use in sneezing or allergy condition is arsenic album. But arsenic album is one of the best remedies to be used in the beginning of the treatment. But in the final level of treatment, we have to go to Thuja. But at the same time, arsenic iodide, which is the hot version of arsenic album, does not need another remedy in many cases, because arsenic iodide is more deeper acting and stronger than the arsenic album. Both have the same modalities. Why I am talking more about arsenic album is as being a practitioner of homeopathy. I'm sure that we all have many cases, and some remedies are found more useful than any other remedy in a particular condition. So arsenic album modalities, one should know that the modalities are the chilly patient, better by warm drinks, waking up at or aggravation from 12 to 2 a.m. So these are the main things in arsenic album. And even in India also, what we see is many of the recurrent colds, recurrent running nose, because arsenic gives both a soric as well as it can be called a tri-miasmatic remedy. Also, one of the things which we have to look for is the moon phases. Many children get aggravation of asthma or aggravation of these allergic complaints during the moon phases. And the main remedies that comes are calcareous carb, silesia, and the last one is alumina. But calcareous carb and silesia are the best remedies if a patient has aggravation during full moon. Also, one more thing is, the next remedy that comes to my mind is natrum muriaticum, because natrum has aggravation during daytime. In the Boris Materia Medica, it is written that natrum can abort many cases, which starts with the sneezing, if natrum is given at the proper time. So usually what we do is, in a tropical climate, when there is, or during summer or hot days, if a patient starts sneezing during daytime, the remedy is mostly natrum. Then coming to the time modalities or postural modalities, of course, sitting up in the bed during asthmatic conditions or with breathlessness or something, the main remedy is arsenic alb. The one who is rocking forward during the attack is Kalicar. The one who is bending backward the head, that is Heparsalve. Or one who is stretching the arms and legs during the attack is Sorinum. Then there is one condition which is very commonly seen nowadays is asthmatic conditions or these allergies alternating with skin diseases. This is a very, or when you go into the history, you will find that in this particular patient, the skin condition was suppressed at some point of time. Even children after birth, before leaving the hospital, many times if they have a rash on the skin, some steroid ointments are applied and cleared. Even the mother may not know that the child had skin disease. So this child later start getting like our Sambucus. They start getting nose block. Sambucus is the best remedy for nose block in infants or dry coryza in infants. So we start with the Sambucus sometimes. So this condition we have to keep in mind, like suppression of skin disease leads to many allergic conditions. And the main remedies given in Ken's repertoire is arsenic, Heparsalve, Sorinum. These are the main remedies if there is a history of skin diseases or any dermatological condition in the infant stage. At the same time, we have the next group of remedies, like we are looking is for the, I think for infants, the best remedy is Sambucus. Next comes the child remedies like anti-tarch, natrum self. And natrum self needs special mention because our Master Kent in his lecture says, Natramur is the best remedy for asthma in children. Or Kent's first remedy for asthma in children is natrum self. Of course, we all know that natrum self has 5 AM aggravation, yellow thick discharges like Pulsatilla or Caliself. Then natrum self, the next time modality which we have to think of is midnight. Because many people used to say that when I go to bed, it starts and it reaches its peak. The asthma or something reaches its peak at midnight and lasts for some time, and then the child goes to sleep. So this 12 to 2 aggravation, if you see, definitely you have to think of arsenic. It can be arsenic alb or arsenic iodide, depending on the thermal modalities. Then comes the 3 AM remedies. In children, one of the most important 3 AM remedies are antimonium tartaricum, ammonium carb, and in both, you have to follow it up with a tuja. Both the ammonium carb and anti-touch, both needs to be followed by tuja. And another remedy which we have to mention here is ipecac. When the breathing difficulty comes, some children have constant nausea. They may not vomit much, but the nausea predominates or nausea continues for a long time like that. Ipecac, another remedy which is very important in children's allergy, asthma, or respiratory complaints. So next comes the 4 AM remedy, or many patients used to, asthmatic patients used to wake up, or some patients who have cough, wakes up at 4 AM and start coughing or start getting asthma or some breathing difficulty. And the main remedy is Kalicar. which has an aggravation or time modality of 3 to 4. Why I am saying is this is in the beginning I told you, in any condition of asthma or anything like this, or the main things we have to look for is the climate, the thermal reactions, the posture, and the time modalities. These four are very, very important in practice. Because in Organon, Hanuman says one should know what is to be looked into in each case. One should know what is to be looked into in each case. This is very important. If he knows what to look into in each case, he can easily arrive at the remedy. That's the most important thing. Because one of the mistakes we have in our profession is people, of course, they have to take the case in detail. But many times they miss the wood for the forest. That is the problem. So they many times miss it. What is to be looked into and what is to be interrogated in each and every case. That's what one should know. If they know that, in few seconds or minutes, the doctor can arrive at the remedy because 1 or 2 questions are enough. Of course, we are seeing the patient. We are, knowing the patient by looking at them, talking to them, and finally recording the case material. So then, what is to be looked into? That should be known. So in any case of allergic rhinitis, in any case of asthma, any case of bronchitis, any case of sneezing, even sinusitis, these 4 areas should be interrogated because these are the areas which can give you a clue to the selection of the remedy. Like that, there are remedies like evening remedies, which aggravates these conditions in the evening. The main remedies are carboH, lycopodium, sanguinaria. All these remedies from evening, it runs to the night. So these remedies also has to be considered. And in allergic rhinitis, which is very common in children now, maybe many people used to say that after taking ice cream or some food from the fridge, refrigerator or something, they develop this. So these chilly remedies and hot remedies one should know. Then it becomes more and more easier. And of course, after the symptoms have come under control in the first 1 or 2 months of treatment, we have to think of the next step, like a sulfur or a thuja or a tuberculum or a sorinum. These remedies should be given in a higher potency. And maybe in the beginning, we have to start with a 30 or 200 to give an immediate relief. As a practitioner, it's very important. The potency selection, actually in our profession, we have not given enough importance to the selection of the potency. Because everywhere people ask for the name of the remedy. What remedy you gave? Nobody asks in what potency you gave. This is a usual thing that is happening. Regarding potency, Stuart Close has given a very clear direction. What he says is, he's just talking about the need of selecting the correct potency. The greatest need of selecting the correct potency is it accelerates the cure process. If you can select the correct potency, the duration of treatment can be lessened and the cure can be established in a very short time. So that is also important. And next thing is the dose, the quantity to be given. Then after that, the observation. This observation, in many cases, people fail because of observation. Because many times the patients come and say, how is your child's problem? Still there. This is the usual answer which many people used to give. Because they, unless and until it is completely gone, they will not say that it is cured or it is better or something. But as a doctor, it is our duty to see what has happened clearly. You have to note down how many times this attack is coming in a month or a week or a day. You have to ask the patient again and again how many times it came in a day or a week or a month after your treatment. The second point is, in observation, is the intensity of the attack, whether it is as same as previously. These two things are very important in the observation of these allergic conditions. And of course, nowadays, these allergic conditions, one of the most important reason or etiology for allergic conditions are the medicines, the drugs they have taken. That means there are the medicines they have taken, mostly the chemical medicines and steroids and all those things. So in the history, when we take the history of that case, we have to look into what are the medicines the patient has taken in his lifetime. Or if it is a child, even the medicines taken by the mother during pregnancy is very important. The next one is the gastric allergy. Sometimes they, like, if you know the allergen, there are some remedies for us, like lycopodium, or in case of strawberry, oxalic acid is one remedy. Like that, there are remedies which have direct action on these allergens and help the body to recover fast. But the main remedy that comes is Nexomica, because all the Nexomica is the king of gastric remedies. And the next, after Nexomica, you know the relationship of Nexomica. It can be Nexomica lycopodium sulfur, or it can be Nexomica sulfur, another relationship, or it can be Nexomica lycopodium carbovich, another relationship. So these type of things, if one knows, even in gastric allergy, sometimes the patient is not aware of or may not be able to give us a clear idea of what is the allergen or what it is or anything. But they just say that it is there. The gastric problems are there. Some people used to say, I am very cautious about my food, but when I went for a party, I did, without knowing, unknowingly, I took some things and then everything developed. And then I know that this thing is there in the food. So this food allergy also, the main thing we have to look for is you continue the treatment for some time, and during the course of the treatment, you just look into how many times this problem came and what was the intensity. All these things are things which you have to observe. Then later, again and again, you have to go to the slowly to the higher and higher potencies until the symptoms are over, and then switch on to the miasmatic remedy and then to the constitution. So there are certain constitutions which have a weakness in certain areas. For example, Nexomica, or a lycopodium, or a carbovich, or a China. Their weaknesses are mostly on the gastrointestinal system. Yeah, like that's why we said we have liver remedies like Chelidonium, Cardus marianus, Calmec, Lycopodium, Natroself, all these remedies, Podophyllum, like that. So the important thing is where these allergic manifestations are manifested, in which system these allergic manifestations are manifested. Then comes the skin allergies. I told you just by touch even. The main skin allergy which comes to in our day-to-day practice is urticaria. Urticaria, you know, there is an edematous swelling like thing which is spread over the body. And the main remedy with the severe itching, and the main remedies are, because it's like a little edematous swelling, urticaria. And the main remedies are Ostox and Apis mellifica. And there is this even Dulcamara. If it is in change of weather, you have to think of it. Even Rustox, when suddenly the rain comes or something, some people develop it. Or when sitting under the air conditioner for a long time, Rustox is another remedy. Then, of course, finally, we have to go to sulfur, soranum, such remedies. So in urticaria, even Natramur is one remedy in urticaria. Like that, the remedies which comes on urticaria, which part or which is the modality, which part is more affected, upper part of the body or lower part of the body. Even the upper part of the body can be sepia or basilinum, another remedy which is very important. So in allergies, what we see is mostly symptoms in the respiratory system, symptoms in the gastrointestinal system, and the last one is the skin complaints. These are the main ones, but there are a few others also, which because of the time, I don't have the time to explain everything. But these are the main things which I'm using for my treatment. Many people used to ask what you are giving and all those things. So these are the remedies. And the gastric system, we have mainly the Nexomica, Lycopodium, Carbovage, even China, Podophyllum, all these remedies. And the constitutional remedies are tuberculinum, calcarecarb, soranum, sulfur, any constitutional remedy can come even. So I think we have covered most of the things in allergy and its cure. So one basic difference between allopathy and homeopathy is allopathy is trying to locate the allergen and to remove it or to destroy it. Whereas in homeopathy, we take it as a deficiency of the constitution or a weakness of the constitution, and we are correcting the constitution. Even identification of the allergen is not really necessary if you know the constitution remedies. So this is the basic difference. That's why when some people, even patients, used to ask, without doing any test, how you know which is the allergen. Knowing the allergen is not very important. And above that is your constitution. Only if there is a weak constitution, this allergen can produce symptoms. And once the constitution is cleared, the allergen will go. And you can ask the patient to try all these allergic things to see whether he is completely cleared of it or not. So usually when people come with the complaints, after a treatment of 3 to 4 months, I used to tell them to try the foods which were allergic to them previously in a small way and a little, and see whether it is still there or not. So these are things which are very important practice. As far as treatment is concerned, one should know all these things. So thank you for the patient hearing and the people in front and behind the camera. And also, I think it is time for the question answer session. Dr.
So let me welcome Dr. Hariharan for the question answer round. How to cure allergies. Dr. Hariharan, you can unmute from your side.
Okay. Can you hear me, sir?
Yes.
Okay.
Familiar.
Thank you, sir. Very nice presentation. Really, I am congratulating you. And you go to the See, you went to the depth of the subject. That so I am appreciating you. See, one of my doubt is that can you explain the miasmatic stage of a respiratory complaint, which is one starting in psoric miasm and then going to the COPD. Can you explain the miasmatic stage? That is my question.
Now, usually the miasm stage is like this. Start with psora, then psychosis, then to syphilitic. This is the way.
Agreed.
Usually we get the patient into psychotic stage. Mostly.
That can we reverse it, sir?
Yeah, completely possible.
In COPD cases, can we reverse the case?
No, it is like this. In some cases, it is there for a long time, and the fibrosis, everything might have occurred, and the complete reversibility depends on the status of the vital force, their age, and chronicity.
Sir, is it the syphilitic?
One thing is clear and sure that we can give a symptomatic relief, even in incurable cases, which is all where the lungs or something, that organ is completely damaged or 75% damaged, and if it cannot be retrieved, we can at least give symptomatic treatment and relieve the symptom.
Time is very less. I have a lot of questions to ask, but a lot of persons are raised their hand. Okay, thank you very much, sir. It is a vast subject and very interesting subject. And a lot of patients are coming to us to cure the asthma cases. And okay, thank you very much.
Very common for homeopaths because there is no other answer for allergy.
Next is Dr. Beatrix Dexner. Doctor.
Yes, thank you. Thank you, Dr. Jones. Very interesting, the presentation and also the lines you gave to us. Very important. And as I'm also having a lot, I'm quasi specialized on allergic patients here in Germany. And I totally agree with your experience. And one thing I would like to add, here in Germany, especially with the children, we have much more eczema than urticaria. So for me, I don't know whether you agree. For me, it's more easy to treat an urticaria than an neurodermatitis. So also these children with eczema will react on certain foods sometimes. And so with the urticaria, I want to give that question here in Germany. If the children have these problems with urticaria, the parents are very keen on only giving biological food, because often the allergen is not the fruit, the tomato or the potato, but the allergen is the toxic substances inside the food. So here we have very little urticaria in children because the parents are very keen on the substance. Do you agree about this connection?
Here also, one of the big problem is many children who have skin complaints get suppressed, and this like eczema and asthma alternating, or skin conditions alternating with the respiratory complaints is always there. And nowadays we all know, as you said, these vegetables and everything, they spray these pesticides, many things, all are contributory factors. But whatever may be the contributory factor, unless and until you have a constitutional weakness, nothing can, affect you.
Yes, that's true. That's true.
We are strengthening our own constitution. We are not trying to going after each and everything.
Thank you, doctor.
Possible.
Dr. Hariharan, need to ask you again a question.
Sir, hello.
Yes.
Hello, sir.
Yes, sir.
Then how can we overcome the genetic factor of these allergy conditions?
Yeah, genetic factors, even eczema or psoriasis, I think almost all the chronic disease have a genetic factor because it comes through your genes, the myosomes of your father and mother, parents are coming through you. And you know why there is no cure for basic chronic disease like diabetes, blood pressure, high cholesterol, allergies, hormonal disorders. Nowadays, why they don't have an answer? It's because they don't look into this genetic factor. Now they have started it. Now they have started to locate the oncology gene, diabetic gene. So in a way, what Hahnemann has written 200 years back, now they are also slowly accepting this, but the credit is not given to Hahnemann. That is what is happening now. So every chronic disease. Now that's why they don't have an answer for chronic diseases. I usually tell homeopaths, we are the only people who can cure a chronic disease completely. And this is our area. And people should concentrate on this.
Okay, very correct. Patients are not waiting, sir. They want immediate cure, and the time is very less, and they are very busy. So they don't wait for that to get the complete cure. We think that that is their fate.
No, it is like this. That phrase is now, going off now. Because some people used to come and say that my father had diabetes, he took medicines, and finally he ended up with a kidney problem, dialysis, and he died, like anything. So now I wanted to try a different thing. So like that, people are, educated people are coming to this. And many people know that for all these chronic disease, there is no cure. They have to take lifelong treatment or pills or tablets for hormonal disorders. For example, nowadays we have lots of hypothyroidism in women, and there is no cure in allopathy. With our Kalikarp, our Astox, our Natramur, mainly Natramur, we can cure this hypothyroidism very well.
Tuja.
Yeah, that comes second stage.
Thank you. And next is Dr. Ram Pravesh Shah. Sir, please.
Thank you, Dr. Binduraj and everyone. Namaskar. Congratulations, Dr. Joseph sir. Very nice presentation. Allergy. Allergy, Shora is the main factor. Background of tuberculosis. Shora, other name of tuberculosis. Shora means itching. Itching means there are two types of itching, positive and negative. Negative means a kind of allergy. So mental allergy. Mental allergy means jealous mind, suspicious mind. So mental allergy is a very important. So allergy and other food allergy, skin allergy, ये जो है internal to external, mental and main factor of mental energy. So next का bilious mind, lycasis, hyosamus, etc. remedy. So mental allergy is the main factor. Very thanks, Dr. Joseph sir.
Thank you, doctor. And few more minutes. Anyone can ask questions.
Thank you, Dr. Binduraj. Yes. I think one point is not mentioned. I think the concomitants. That is also very important. As Issac are always mentioning a case of this coryza with polyuria. So these are very common, but with polyuria, the connection is there. So concomitants are important. Then again, attenuation is another important factor, I think. If you prescribe a remedy, you should be very cautious because the medicine given in water, diluted form, that will aggravate, especially if you give a remedy. Then another thing you mentioned, that's another important thing is knowing allergen is not important. That is the crux of homeopathy, I think. No, we can treat without knowing what causes. That's most important. That's the beauty of homeopathy. Anyway, nice presentation as always. Is a real professor. Thank you, sir.
Thank you.
Thank you, Doctor.